We're going to go ahead and get started. Looks like we have almost 50 people joining us this morning. Good morning. I'm Andrea Spencer, and I'm Vice President of Communications here at Elder Source, and we are the manager of the Caregiver Coalition of Northeast Florida. So welcome today to this particular virtual workshop, Navigating Long-Term Care and Tapping into Available Resources. Over the last couple of years, we have hosted in-person and virtual sessions for our caregivers in Northeast Florida, and we always have a wonderful turnout. The great thing about today is it's recorded and will be shared publicly. So those who have RSVP'd and not able to join us today will be able to view it at their leisure. Next slide. So about the Caregiver Coalition, our mission is to collectively elevate caregiving and improve the quality of life for caregivers in Northeast Florida. And the vision of the coalition is where all caregivers have the knowledge and access to resources to support the caregivers and those in their care. We have over 20 organizations and companies working together to support all of you, the caregivers. You can go to caregivercoalition.org, go to our social media, and you'll find past sessions of the virtual workshops, as well as some great resources. So that's all about the Caregiver Coalition. Next slide. Today's session, as I mentioned, will be recorded and posted on the website for anyone who can't attend. And if you want to go back and collect some notes, additional notes for yourself. So don't feel compelled to write everything down. You will get this session as an email link along with all of the resources that we're going to be sharing today. We are asking and we are controlling all of the viewers here during the session. Looks like we've got about 53 people. We're going to keep you muted and keep the cameras off, but you will have a chance to ask questions of our experts today. And those questions will be answered at the very end in the Q&A section. So you could put them in the chat. I will collect them and we'll go through as many as we can. We've got a number of folks here online. So you know how it is. We might have some technical difficulties. So be patient with us as we fix any issues. Today in this particular session, we're going to be going to a couple of live websites. So that might be a little bit of a transitional blip, but don't worry. We'll make sure that everybody stays connected as best as we can. And as I mentioned, following the webinar, all the resources will be emailed to everyone who has RSVP'd. And of course, you're so welcome to share it. Take notes, but know that you'll receive this information in your inbox. And let's go ahead and get started. Next slide. Oh, one last thing. If you need closed caption, we have enabled the live transcript and you should see the live captions come across the bottom of your screen. Take a minute to look at these directions. Sometimes I know it's a little bit easier to follow along if you've got the subtitles. So you can adjust the size by hitting more, clicking the subtitle settings, and to view the full transcript, click View Full Transcript, and this option will display it off to the right as it's happening live. Next slide. So I'd first like to introduce two of our wonderful presenters today. They are part of my team here at Elder Source. We have Renee Knight, and Renee is Vice President of Community Services here at Elder Source. She is in the position, she leads a highly effective team of 39 staff members, including the Aging and Disability Resource Center helpline, intake and screeners for our long-term care services, and the waitlist placement and specialists in the SHINE department serving the health insurance needs of elders. Renee is definitely a results-oriented professional with over 30 years experience in the aging industry, and she had earned a bachelor's degree in psychology and master's in healthcare administration from the University of North Florida. Welcome, Renee. And her teammate, Kadondra Sales, is intake and screening supervisor here at Elder Source. Believe it or not, she just celebrated 20 years with our agency. Now, that certainly says a lot about the work that she does and the passion that she has for supporting older adults. She is responsible for a staff of 14, and they conduct the assessments of clients seeking help through the statewide Medicaid-managed long-term care program. I'm going to mute myself. Keep an eye on the chat screen for your questions. But Kadondra and Renee, thank you for joining us today.
Thank you, Andrea. And I'll kick it off and get us started, and then I'll turn it over to Gadandra. So next slide. Okay, so we're going to talk today about the Aging and Disability Resource Center. And like Andrea said, we are part of Elder Source and my department, the Community Services Department. Next slide. So we're going to start by sharing the area that we take calls and that we complete screenings. And you'll see right here the 7 counties that are part of our service area. And before we move on to another slide, I'd like to say we have counterparts across the state, and there are 10 other agencies like ours. And we are all connected with a database for resources and for sharing information and for also helping us track our clients that are being waitlisted or being served in our state, in our entire state. So with the planning and service area, you'll see it's Nassau down to Volusia over to Baker. We take calls and we conduct the screenings. So next slide. So let's talk about our purpose at the Aging and Disability Resource Center. We've been around since 2007, and we have a team of helpline, and I'll go into more information in a few minutes, but it's about integrating information and following up with referrals for elders and people living with disabilities, and helping them with eligibility determination inquiries and things like that. We are the point of entry and access and coordination of services for all Floridians seeking the home and community-based services. Those are in-home services and services like assisted living facilities. We assist the Medicaid eligibility for those individuals who are released for the statewide Medicaid managed care long-term care program. That's the home and community-based piece of it, not the nursing home piece. And then we also manage the release of the names, the waiting list for the general revenue programs. That's the funding that our state of Florida gives us for serving elders in their home or at an adult day care facility. So those wait lists are all managed by our teams here at Elder Source. Next slide. So the helpline, the ADRC helpline, we are the gateway to community resources for both the aging population, for caregivers and persons with disability. Our goal is to connect customers with the information and resources they need. We have live phones active 8 to 5, Monday through Friday, taking those calls, providing that information to individuals who have questions about community services. So next slide. How does the helpline work? A caller will speak with a customer service specialist to understand their needs, and we'll check eligibility of programs and services. The specialist will connect the client with available resources. And a key part of their role is to schedule those telephone screenings that Kadondra is going to tell you more about. But real time, when someone's calling in, we are scheduling that appointment for a specialist to contact them to complete that screening. So that all happens when they call into our helpline. Next slide. So here's kind of how it all flows. Starts out, someone calls into our helpline, customer service specialist answers it. And if the call is related to Medicare, then it's turned over to the Shine staff, and I'll provide more information on that in a few minutes. And that's with our Shine volunteers, about 40 volunteers that we have. In the middle of the screen there, you see home and community based. And the SMMC, that statewide Medicaid managed care, long-term care program, or the Medicaid piece of it. And then we work with the Department of Elder Affairs CARES team, and there are lead agencies, provider agencies out like Aging True, Baker County Council on Aging, and we also work with DCF, Department of Children and Families, for those clients that are released for the Medicaid long-term care program. In the far right, you see we connect to resources that's internal and external, because we have a whole set of caregiver support that you're probably aware of. And we will, when they call in, we'll make a referral to our caregiving team for possible services, telephone reassurance, things like that. And of course, external. We are, some of our top reasons for people calling in is looking for housing nowadays, or looking for food pantries, looking for transportation, looking for electric assistance and things like that. So it's all about connecting and those resources. So next slide. We're going to talk just a few minutes about our SHINE team, serving health insurance needs of elders. And they're unbiased. They are providing counseling. These are a network of volunteers who are experts who go through training to be able to provide free and unbiased counseling. And they're empowering the Florida seniors to make informed healthcare choices. So our busiest time is, of course, open enrollment. So next slide. So once again, free and unbiased counseling on Medicare benefits. It's available all year long. We have quite a few who call in for people turning 65 and trying to navigate that world of signing up for the first time. And our busiest time is October 7th through December 15th, which is that open enrollment. And our SHINE volunteers will educate on original Medicare, the Medicare Advantage plans, prescription drug coverage, supplement insurance policies, prescriptions, drug low-income subsidy. And the last one is Senior Medicare Patrol, and that's preventing that Medicare fraud. When our counselors are talking with individual beneficiaries, or we're providing outreach events and presentations, we're on the alert for Medicare fraud and teaching our beneficiaries how to protect their card information, how to look out for claims or things that are fraud against their account. So all of that, our team as volunteers are just fantastic and experts. So next slide. And I'll turn it over to Kadandra.
Hello again, I'm Kadandra Sales, an intake and screening supervisor at ElderSource. So I'll just go over the intake and screening process. Once someone calls our helpline and the helpline determines that that person is in need of home and community-based services, they will schedule an appointment, and they make that referral over to our department. And what we do is conduct a telephone screening. The telephone screening takes 30 to 45 minutes. It goes over health conditions, living situations, caregiver and home environment. At the completion of that assessment, clients are placed on waiting lists for various programs, depending on the criteria for each program. You must be a Florida resident and be age 60 and older, or have a disability in age 18 or older for certain programs. Clients, as we stated, are placed on a waiting list after that telephone assessment. Clients that are not released from the waiting list for any programs after 1 year are reassessed annually. We will contact you to follow up on if you're still in need of services and do an update assessment. Clients can also give us a call back at any time if they have a significant health change from the last assessment, if we need to do a new updated assessment. We also manage the waiting list, waitlist release for our other home and community-based programs, such as the Community Care for the Elderly, the Home Care for the Elderly, and the Alzheimer's Disease Initiative. Those are various programs that offer services in home for clients And when funding is available, we will identify the clients that are listed as the frailest on our waiting list, and we will release those clients, and you will be contacted by a case manager if you are released for one of those programs to receive services. Next slide. For clients that are released for the Medicaid program, we get a release normally monthly. That the release comes from the Department of Elder Affairs. They identify the frailest clients that are on our waiting list, and they will give us those lists of names. In order to go through the Medicaid process, there is a medical form, the Medical ACA Form 5000-3008, that has to be completed by a doctor. Once that is completed, it goes to the Department of Elder Affairs, the CARES unit. They will go out and schedule a face-to-face assessment to determine all the needs. They do a comprehensive assessment. Based off that, they will issue a level of care. Once that is done, we can apply for the financial eligibility. So we do have staff that can assist clients if needed with doing a Medicaid application. If they are approved by the Department of Children and Families, they will get a letter from the Agency for Healthcare Administration, their enrollment broker, welcoming them to the Medicaid program, and they're able to choose one of 4 managed care organizations that we currently have in our area to receive services from. And for our staff that are helping with the Medicaid applications, it's only for those clients that are released for our waiting list for those programs. Next slide. This is our contact information. If you need to call us to reach our helpline, it's at 1-888-242-4464. That's the first number to start for. We do have an intake form if you like to fax in a referral to us. And at the bottom, there's a link to the ACA website that goes over the step-by-step process from the screening, the waiting list release, and it has a few frequently asked questions if you have questions regarding the Medicaid program.
So Jessica, I'm going to go ahead and show the website so people are familiar with when they log into there. So I'm going to do that and share my screen. Can you all see that? This is the page that Kadondra is mentioning, statewide Medicaid managed long-term care program. I will be sending you the link in that follow-up email so you'll have easy access to know where to navigate if you've got questions. Okay, we're back to the group. So I've got a couple questions. I'm collecting them. And if you recall, we're going to answer all of them at the very end. So definitely send those in. We've got wonderful experts here today that will certainly, hopefully point you in the right direction for all of these complicated questions. So I would next like to introduce Patricia Vidal. She's the administrator for the Office of Data Dissemination and Transparency within the Florida Center for Health Information and Transparency for the Agency of Healthcare Administration, often called ACA. So welcome, Trish. Thank you so much. I want to just give her a quick little introduction. She's worked with the agency for approximately 17 years, and her current responsibilities include managing the unit that disseminates statutorily required Florida discharge data and several transparency websites. She's lived in North Florida for over 30 years and has been a licensed nurse for approximately the same number of years, and she spent the last 17 working for this agency. She's a graduate of Flagler College with a bachelor's degree in business administration, and she feels it's her duty to be a good steward for the Florida data that we collect and disseminate while ensuring its transparency, which I think we all can understand and appreciate. That can be very difficult in today's day and age with all this technology. So welcome, Patricia. I'm going to mute myself, and then we know that in a few minutes, she's going to help me navigate through the ACA website as if I'm a consumer, and we'll get to those slides, and you'll be able to see a little bit on how that site works. Thanks, Patricia.
Hi, everybody. So I go by Trish. So you heard her call me both things, but for the most part, everybody calls me Trish. So if we could go to the next slide. So today we're going to talk about agencies' healthcare transparency websites. Next slide. So we have three primary websites, Florida Health Finder, Florida Health Price Finder, and My Florida RX. The Florida Health Finder is our primary website. It's the oldest website, has a vast amount of information and data there. And the primary two components are comparing quality. So there's a compare component, and then Locator, which is a tool that's used to get to the provider page for the more than 5,000 different facilities that we either license or certify. Price Finder is a newer website. I think it's been out there since 2018, and it has approximately just under 400 different care bundles. And what those care bundles do is allow you to see the price of a whole procedure like a knee or something like that. Then the My Florida RX, which is talks about prescriptions. It has data for Medicaid, Medicare, and commercial plans. And there's how they list that is the top 300 most prescribed, and then there's an average price, and you can narrow it down to your county or your area of Florida. Next screen. There we go. So basically, we're going to be covering Florida Health Finder. Again, that's the oldest in our primary website. And the things that it offers you is it provides easy to understand healthcare performance and quality data. Information is updated daily from the agency's electronic licensure database, which is where we collect a lot of that geographical data that you'll see on the profile page. We have the provider profile pages, which allow the consumer easy access to licensure information, owner information. And then there's a multitude of links to different documents and inspection reports that also help you gauge the quality of a facility that you might be looking at. So how consumers use it is that they can search a facility, they can compare facility ratings. There's healthcare data, which we do disseminate out there. We also collect it and then we disseminate it by order of statute. And we have a lot of healthcare resources, things like consumer guides and just links out to outside resources that are helpful to the consumer. So next slide. So again, this is the oldest website. So it's probably 20 years old now. And it has gone through a lot of different changes. Although some of the navigation remains the same, some of the data is the same, we're always trying to upgrade it and make it more user-friendly. And this most recent phase, which went live in December of 23, excuse me, was kind of a drastic change for the look and feel. We were trying to bring it in more closer to ACA's branding. So that's the big color changes that you see there. But it has mostly the same type of information. And for someone who used the old site, that's why we included the old site, which is on the left. They may have been familiar with that look and how to navigate that. And so we are, trying to do some of these outreach webinars to help people understand that that same information is still there. It just looks a lot different, and there is some functionality changes. So next slide. One of the things that we did is we tried to bring as much of the useful tools and dashboards and information forward. So we added on the left, you'll see it says Florida Health Finder Tools. Those are actually flip cards that if you hover over it, it flips and gives you the link specific to that card. So the first one on the top is healthcare data, because we have a lot of consumers that come in and order data. So everything that you need to be able to order data or see our data is on the back of that card, and you can quickly link to it. So it gives them an easy access to that. On the right at the top, we also added what's called mega menus, and there are several tabs that run across just under the static bar. We'll look at it when we go to the live site, but each of those, when you open those tabs, it gives you a larger area to include more links to the information that's provided to the consumer. And below that is the dashboards. In the old site, they were located in multiple locations, and you had to just remember how you navigated to get there to see a dashboard. So we brought those all forward and put them in one area for dashboards, and we hope to add more data there soon. So next slide. So this is just a reminder that the site is mobile friendly. It does line up a little differently. So if you're looking at a computer screen, things will run from left to right as far as, you know, the different flip cards and the dashboards. When you do get to a mobile site, they stack them one on top of the other so that you're scrolling one image at a time. But it's pretty user friendly, and I just wanted to give you a glimpse of what that might look like. Next slide. So this is the home page. This was the done in that first phase of the updates back in December. And if you look at the top where the big red buttons are, that whole piece up there is called a static header. And the things I guess I would tell you about that is that if you get anywhere in the site and you're not sure and you want to come back and just start navigating again, that travels with you. So you could just click home and get back to this page. The other thing that's up there is you'll see the tools and the dashboard. If you click either one of those, they'll take you straight down into that area of the home page. Or if you go to the red buttons, the compare and care is what is called a call to action. There's actually 3, and we'll go over those when we go to the live site. And then the other buttons are for the Price Finder website and the My Florida RX website. Those are direct links to those sites. So they're convenient here. If you get here and know you want to go to the others, the buttons are conveniently located there. And then just below in the white writing there are the 5 different tabs that we talked about. That's considered the mega menu. When you click on one of those and expand it, it gives you all the links for that particular topic. So we have next slide. So from the call to action buttons, again, I said there's 3, and we're going to go to the site so it'll be easier. But I wanted you to see that if you hit any of the call, or if you hit the 2 call to action buttons that take you to compare and locate, it should open to this screen. You have 2 things, pieces of information, I guess, that you have to select to get your search going. But there's also a little how to use this search at the bottom if you need a little extra help with that. And if you get in here and you feel like it's slowed or you're not doing what you want, you can go back up to that static header and hit home, or hit the compare and locate square at the top, and just start over. Sometimes I like to just get in there and push buttons and poke around, because that's the best way to learn. So next slide. So on this one, I kind of did one of the searches, and this is what we're going to walk through in just a minute when we go to live site. So for the type of provider, in that drop down, there are approximately, I think there's 38 different facility types that you could search. So you would open that, select one, and then based on what you selected on the left, whatever is available for that facility type, when you open the drop down on the right, that will tell you what you can select. So I selected locate because that's the one search we're going to do to get to the profile page. And as soon as I did that, that little map popped in there, and the option with the drop down for counties. So I can either hover on the map and click a county if I know where my county is, or I can go to the drop down and put Leon, which is what I did because I'm in Leon. So, and then you would hit submit and get your results. So next slide. So now we're going to go to the live site. So Andrea, I'll let me know when we're ready. So you're muted. Andrea, you muted.
Sorry, guys. Okay, there you go. First little technical difficulty. All right, I'm unmuted. Thanks, Trish. So guide me through the choices. I've just popped in here and I want to find some information.
Okay, so you're on a different site. So if you scroll down a little bit, if you click on up a little more, I thought we had the other site queued up, so you can actually
I'm sorry because I had both of my things. So let me
just click on that. It'll take us to we want to go to the live site. There you go.
Right here.
Uh-huh. Oh wait, what was it? No, the one above it. Where's this Florida Health Finder? I'm sorry. In the
there we go. All right. There we are.
Okay. All right. So we talked earlier about the static header, which is across the top. It has home, contact, tools, dashboards, and then the other red squares, which one is compare and locate, and then again, procedures, which takes you out to Price Finder, and prescription, which takes you to My Florida RX. So in the body there's a red button and it says search provider. That search provider button and the square at the top that says compare and locate, both are call to actions that take you to the screen that we looked at previously. And I'll explain this, but I can explain it again later. We have approximately 38 different facilities that we can do searches on. Of those, approximately, I think there's 8, we have an additional search, which is called Compare Care, which takes you to the quality measures associated with that particular facility type. So that's the compare and locate. And because sometimes we have individuals that come in that need to see something specifically on compare, there's one more call to action button, and it is in that list of mega menus. You'll see it says agency information, healthcare education, external resources, and then the one that says quick care links. If you hover over the quick care links one, the tab, go to the actual tab and go over to your right.
Oh, there we go.
Okay, so click on that. So those are the facilities that, in addition to the locating tool, they also have compare. And if you click on those, they go directly to the summary page for those. But we're not going to do that today. But that is where that information is located. But that's why I say there are 3 call to action buttons. One that's a quick link to the compare, and then the other 2 that take you to locate. So if you'll click on the one in the body that says search provider, we'll start with that and we'll use the other later. Okay, so this was the image I showed you earlier. If you do a drop down and then you can scroll through those, and we're going to look for nursing home. Okay, and then in the next one on the right, if you drop that down, for a nursing home, there are 3 options because we do have compare for nursing homes. That's what's on the quick link. Then we have locate, and then we have locate by proximity. So we're going to do the middle one, but I wanted to tell you something about the proximity one, and we don't have to open it. But the proximity would be if you needed to search something, you would enter the address, your address, or the location that you're wanting to know what else is around that one. If you do that and put in an address and give it a distance, it goes up to 100 miles. It's like 1,000 feet through 100 miles, I believe. And then did the search, it would tell you what facilities, according to what you selected, are in that vicinity. So we won't do that one, but it's there. And again, I recommend you just go and poke around. That's the best way to learn sometimes. So we're going to click the middle one, which says locate facility. There you go. And because we chose locate, again, the map popped in. And if you want to click, Andrew, just click your county, and you can do it by either the drop down, or if you know Duval. Are you in Duval? Where are you at? Okay. And then scroll a little bit, and you want to hit that search. Okay. Now let's scroll down some. Okay, so here are the results. And so this is a complete list of what is available as far as nursing homes in the county you selected. So scroll all the way to the bottom and it'll give you a total number of facilities. Right there it says there are 33, I
Yes.
think. See it's a little small for me. Okay, so we're going to go back up and work our way back down and select one. So go back to the top again and further up, we want to see, keep going up. Okay, so this is an advanced search. So an advanced search is like being able to filter more. Once you know you're looking for a nursing home, and let's say you had something specific, you just want to narrow it by the number of beds, or by a license status, or by a specific program they might have, which is on the far right at the bottom corner, you could narrow that search and bring back only the facilities that have that quality you've picked. We're not going to do a narrowing search this time, but that's available. And then you would pick your thing, hit search again, and it'll refine your results. So go down just a little bit. There's one more search filtering. Okay, so this one, this sits on top of these column headers. This will allow you to search within, so sometimes people just bring back all of nursing homes for the whole state. And they may be looking for maybe by name. You can narrow it by name there, or an address. They know something about it. They don't know which one it is. So they can, maybe it's a city, it's something. They can narrow, but this is only going to narrow the columns that are available that you see. That's what those are. But you can also hit export, which would bring back just the column information you're seeing, or you can hit the other, which is the export facility data, which will bring back this information that you're seeing and some additional information from the profile page that we're going to look at. It's a much bigger export, but depending on what you're using it for, if you are, some businesses look at, what's available in their county and they need this other information. So that would be where they would pull that from. So I'm going to let you pick the nursing home that you want to look at. I think you had one that you may have already. And then you see how she hovered over the name of the facility that on the right there. That's how she made the selection to get to this particular profile page. So at the top, you'll know you're at the profile page because it says profile page, name, and that it's a nursing home. And then this is everything that we talked about, this information updating nightly. So as the licensure unit gets new information, sometimes it's just randomly sent in because they've had a change of owner or a change of address or some information that they're required to statutorily required to report, or they're doing the renewal, or even if it's a new application for facility. They collect all of this on that document and it is put into our licensing system, and we pull from that to build these profile pages. And then we have some other things that we pull in. So on the left, you can see it's the facility profile, and it tells you a map of where it's at, so you can have a general information how to get there. There are some driving instructions, and it's you see their website, and then their street address, mailing address, phone number, that type of information. On the right, facility information talks about their nursing home, who the administrator might be, financial officer, owner, and since when have they owned this. And then down a little bit more, we've got the licensed bed types. That's important if you have a person that you're wanting to put and they need a specific type. You want to see if it's available there. Like I think this one has pediatric. This one does have no pediatric. Okay, but if you needed to know that, that would be there for you. Then this is identifying information like the license number and the file number. So below that, we have emergency action items, ACA reports, and consumer guides. So the ACA reports is got some information for inspection reports that those are routinely done at these types of facilities. And then the consumer guides is linked to ones that are specific to nursing home. and we have, those are also available in that mega menu. There's an area that says consumer guides and you can see the whole list, but these are specific to nursing homes. A little lower is compare quality and pricing. So this links out. So before, when I said we're not going to do the search for compare, if you needed to see some of that information, clicking there would take you back into that other compare care area, and you could do that. But again, we're not doing it for today's walkthrough. And then services and characteristics. This is also important because it tells you what kind of services, and depending on your loved one and what their needs are, there may have a language that would be helpful if it was available, or it gives you some other information there. And then the emergency power plan summary. This is important, in Florida specifically because of the storms. You may have a loved one in a nursing home here, but you may not necessarily be here. You could be, far away from them. You want to make sure that you know what the plan is. So there's information there for you. Legal actions. I think, well, two things is that the change of ownership kind of gives you a timeline of who owned it and when, and which of these, either sometimes they're just small fines or whatever the issue is there, under which ownership they fell, I guess is probably the better way to say it. And depending on, you can go in and look at them. Some of them are kind of routine fines that happen during survey. They may have a small thing that needs to be repaired and they're cited for it, and sometimes cited for it and or have a fine amount, and then it's an easily fixed item, and sometimes it's more severe, but you do have the ability to go in and see exactly what those are. And then at the bottom, there is some more information. There's a link to the ACA licensing offices. If you had any questions there, you can print these results or see the glossary. So if we go back to the top of the screen, let's drag that all the way up. So let's say I got here. I can't remember how I got here, and I just don't know. I have two options. I can click home, or I could click compare and locate again and start the search over. So that's why I said there are two great buttons. We came in with the one that was in the body, which was, find the profile search. But once we're at this point, we can't see that one. But this one at the top, the compare and locate, would either start the search over, or we can just go home. So for this purpose, just click home. And I just wanted to show you one more thing. So if you, okay, so let's scroll down. So these were the tools that we talked about earlier. And you see how easily they flip with giving you the information. And those all are links that will take you to that. A little bit further down is the dashboards, which we are adding to. And again, those used to be spread out through the old site. So it was kind of hard to remember where they were and how to get to them. And this just made this so much better for the consumer. And then let's go further down to the bottom. There is a little how to use this site. It's very brief, but I think it covers some things that might be important. I personally think the best way is just to get in there and start pushing buttons until you break something, and then tell us, and we'll figure out what went wrong. And we're here to help if you get in there and say, I just really need to know how to get from this point to that point, because maybe that's all you're going to use it for, and we're available for that. But at the very bottom of this page, there's also an FAQ link. Okay, it's at the bottom. There you go. So it's the one, yeah. It's all the way at the very bottom. It's small, but can you see?
Like,
no, further. There you
sorry.
go. Oh, it was there too. It's in two places.
Yeah.
That's right. But the nice thing about this is it's just a lot of information, too much for us to go over here, but it does answer some of these questions, and it could create more questions, which is fine. If you'll get this to us, we can, get you back that information as well. But I find this very useful, and I do like it. So if we can go back to the top. Okay. And then the mega menus, we briefly scanned over those. So if you go to where it says agency information, there. and just click on that. That's how it opens up. This is everything that is things that you may need to know: public records request, Medicaid information, inspection reports. There's a lot. And then each tab has several different things. I won't go through each of them because of time, but I think click on everything you can click on and just see what it gives you. So we can go back to the last slide on our presentation.
Okay.
You can just close that out. There we go.
Next slide, Jess.
Okay, so future enhancements. We're currently in the second phase of some enhancements right now, which are going to fix all the problems, hopefully all the problems that were identified in the first release that happened in December, because there were a lot. It was a lot for people to ingest because some of the changes were very different. But we do have some future plans. We're in phase 2 right now, so there's currently changes ongoing. So if you do run into a problem or a glitch in the system, just reach out to us. I love hearing the feedback because that's how we figure out what needs to be fixed and helps us to move forward in these future enhancements. So a couple of things, I won't read them all, so we're wanting to increase data availability, and that can happen in a lot of ways, but primarily that starts with statutory language. So anytime that comes about and they tell us we need something more, we have an advisory council that also works with us, and we lean on them to give us ideas of what they think needs to be out there, but we take all suggestions from consumers as well. Animated infographics, I'm very visual. I think the older I get, the more visual I am. If you can just show me what it should look like, I can figure it out. So I like the animated infographics. Sometimes they're, as opposed to like a long video or something like that, if I can just kind of see the path, I can figure it out. So we're wanting to incorporate more of those. Virtual assistant, I like that. It is something new. It's probably going to be coming to a lot of websites, and we try to stay ahead of the game of knowing what's coming and what would enhance the user experience. So we foresee that coming in the future. And then the last one is measuring value and savings, which is always on our list of to-dos, no matter how many times we come back to this site or any of them and upgrade them and make them better. The quest is to give the best value and the best savings. And that concludes mine. I think the next slide is the last. Yep, it just says thank you, and I appreciate you including us in this presentation.
Thank you, Trish. We have collecting some really great questions, which we're going to answer after Joe's presentation. So thank you for all of those folks who are putting them in there. They're really, really great questions. Let me introduce our next speaker, Joe Solsana. He's Director of Veterans and Veteran Benefits at the National Association of Veterans and Families. It's navf.org. He's the founder and director of the National Association of Veterans and Families. It's a nonprofit organization based out of Green Cove Springs, and it provides support and advocacy services for wartime veterans, their spouses, and families from World War II, Korea, Vietnam, the Gulf War, and through current conflicts. He's an entrepreneur, owns several companies, and he has a master's in science degree from East Texas University and attended St. Mary's Law School. Thank you, Joe, for being with us today. I appreciate it. And again, we'll have a Q&A at the very end. I'll read off these questions, and our experts will be happy to answer them for you. Take it away, Joe.
Okay, thank you. Next slide. Okay, let's see if I can make this larger. It came to me. Again, we're a nonprofit, and we basically are nationwide, but our focus is in the state of Florida. Here in Northeast Florida, we probably have 260,000 veterans plus their spouses. So that's close to 500,000 of our population. And so we're very, very glad to be able to be in this area and handle this large volume of veterans. Next slide. Okay, can't read it too well, so I got to enlarge it. So how do I minimize myself? Do, 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 do. Okay, so I'm gonna have to do this by memory.
Joe, if you go up to the top of your screen and the little
Okay.
dots, there'll be like a gallery view. And you can put everybody in the far right corner. Jessica,
Okay.
I don't know if you can help him change his screen. Maybe that would be up to him. But
Mhm.
it's in the upper
Right.
right
Have
screen.
you side by side speaker?
Try that.
Yeah, try that one.
There we go. That's it.
Yay. All right.
Hey, okay. Well, anyway, the first part of our mission is the term we use, you don't know what you don't know. So we do seminars every week educating our veteran community on benefits that are available from the VA. So we want to educate our veteran families. Our benefit focus is on all eligible veterans and spouses. Many other organizations are handling, veterans from 1994, but we handle all of them. We shepherd in the planning process, even if you've been told that you have too many assets or too much income. Individuals have a tendency to get online, especially the children, and to try to find information. And there's a lot of misinformation online. We file fully developed claims on behalf of the veteran and spouse. What does that mean? That means when we send in a claim and we complete the application, it is the I's are dotted and the T's are crossed. So we just don't send something in that's not complete. In the last 18 years, we've handled over 50,000 claims and appeals, and we've only had 47 denials. So that's not a bad record. Next slide. So applying for VA benefits, 73% of claims are denied. Why? Children go to the VA website and they try to file directly to the VA. The VA website is confusing. I try to get on there and find things at times. It is difficult for me. And this is what we do every day. They file for the wrong benefit. On the application, it asks, are you filing for compensation or pension? And the first thing that comes to mind is, well, I want to get compensation for my disability or for my mom or dad. And that's for service-connected disability. So pension is the right answer. That is for non-service connected disability. So for individuals that are at home, are they in assisted living or nursing home? Next slide. So what are planning strategies for senior care? Well, first of all, how are you going to pay for things? You're going to pay from your income, and then you're going to pay from your savings and your investments, and maybe long-term care insurance. As we tell everyone, if you have long-term care insurance, you want to keep it. If it starts to get too expensive, maybe you can cut down the benefit and cut down the premium. We had a couple of years ago that they couldn't afford their long-term care insurance, so we recommended cut it in half. Well, it cut the benefit in half. 6 months later, husband goes into a community and at least they had that part of long-term care. So VA pension plus aid and attendance is another strategy for paying for long-term care. The last one there is ABD Medicaid, aged, blind, and disabled. So that's the part of Medicaid that pays for nursing home. The last is children pay. Normally, parents don't want their children to pay. And that's the last thing, but that may be their only option if they're for a widow that's lost her husband's pension because he did not put a survivor benefit, and her monthly, Social Security is the only thing she's living on, so she may have to go to her children or go to Medicaid. Next slide. Next slide. So the Department of Veteran Affairs, who represents you before the VA? First of all, let me go from left to right. The Florida Department of Veteran Affairs, each county here in Florida has a county veteran service officer, at least one. In Jacksonville and Duval County, there's supposed to be 12 service officers. They're fortunate if they can keep 6 at a time. There's a lot of turnover. There's the chartered organizations such as the American Legion, VFW, DAV. Each one of those may have a volunteer veteran service officer. The third on the right is the VA accredited attorneys and the VA claims agents, and that's what we are. NAVF is a VA accredited claims agent, which means we get all our training and everything directly from the VA. Next slide. Department of Veteran Affairs. So there's 3 divisions within the Department of Veteran Affairs, and this is where it can get confusing. On the left is the health division. So the health division basically handles the hospitals, the clinics, and the social workers, and they have some, specific healthcare benefits for the veteran. In the middle is the benefits division, and the benefits division handles the compensation, which is service-connected disability or non-service-connected disability. And the third on the right is the burial division. The burial division does the best of the 3 divisions. We're very fortunate here in the Jacksonville area that we have the Jacksonville National Cemetery that they started back in 2003. Now you will notice that there's no arrows between the 3 divisions. They do not communicate with each other. Sometimes we'll have a veteran come in, oh, the VA already has all my benefits or records. That's the health side, and they will not share it with the benefit side. So we have to kind of start over in many ways. Next slide. As I said, the benefits basically are what we specialize in. Next slide. So what is pension plus aid and attendance, or A&A, as it's commonly called? A&A is a Veterans Administration non-service connected reimbursement benefit that's funded by Congress for veterans and surviving spouses of a veteran that served our country during a wartime era. They didn't have to be a combat veteran, but they had to serve during a wartime. And they have to be paying for either home care, assisted living, nursing home, independent living, with a third-party caregiver. So the gentleman here in the picture, when I took this picture, he was 102 years old, and he was at Fort Caroline. And what was sad was that he could have basically qualified 12 years before when he was 90 years old. And his son was paying for his care. His son was still working, who was in his 80s now, paying so his dad could be in that community. So I don't know who was happier, basically dad or the son, that once we got him the benefit. Next slide. So how much will the VA pay? Well, for a veteran that's still married, it will pay $27.26 a month, or $32,712 a year. A veteran who does not have a spouse any longer, it's $2,300 a month, or $27,600 a year. A surviving spouse or widow, it's $1,480 a month. For a spouse who still has a veteran still living, it's $1,780 a month. This is all tax-free, and it is paid into the checking account of the applicant. Next slide. As you can see, it says tax-free. So what are the eligibility requirements? First of all, you had to have a wartime service, need assistance with activities of daily living. There are some income limitations and there are some asset limitations that I'm going to get into. Next slide. So World War II basically was December the 7th, 1941, the day that will live in infamy, to December 31st, 1946. Now, my father went into the service in January of 1946, and the whole year he was in, he drove a Jeep in California. So he was not a combat veteran, but he was a wartime veteran, so he would have qualified. Korea is June 27, 1950 to January 31st, 1955. Now, Vietnam is a little bit different. It's August the 5th, 1964 to May 7th, 1975. Now, we did have troops that were in Laos and Cambodia that were making sorties over into Vietnam. So for them, from January 28th to 61 to August the 5th, 1964, they would qualify, but we have to have copy of their orders, which they would have had. The Gulf War, which is August the 2nd, 1990, through a date to be set by the law, President proclamation, that has not been done yet. So anyone that's serving that gets out, then they could qualify for this benefit, or the spouse. Veteran must need help with ADLs, or they need to be in a protective environment. So if the doctor doesn't give them any ADLs that they need help with, we get a letter from the doctor that where they need to be in a protective environment. Next slide. So what are ADLs? There's medicating, bathing, dressing, toiletry, transferring, and eating. So a lot of times we have individuals that their son or daughter are taking them to the doctor. So that is transferring. Next slide. So to qualify for full benefits, income must be less than their unreimbursed medical expenses. Again, what are unreimbursed medical expenses? Assisted living cost, nursing home cost, home health care service, health insurance premiums, Medicare premiums, and independent living with a third-party care agreement. Now, again, that third party can be a child who's helping them in independent living. So this is where sometimes it gets confusing. They say, oh, I'm in independent living. But if that child is taking them to the doctor, that qualifies as a unreimbursed medical expense. Next slide. So the VA will look at countable income. So on the application, that we have to list Social Security income, retirement income, rental income, business income, interest income, immediate annuity income, trust income, and reverse mortgage income. Next slide. So what's the allowable assets? The maximum amount that you are allowed is determined by the VA and can change each year. So right now, total assets are $150,000. And that includes the income. Now, there's some things that can be that don't count. So it just depends on when they have this asset and whose name it's in. Next slide. So what are the assets that we have to put on the application? Cash, checking, savings, stocks, bonds, mutual funds, CDs, IRAs, 401ks, annuities that are deferred, property net value, and business ownership. Next slide. So what is it that the VA does not count? The home. The primary residence does not count if it's on less than 2 acres at application. We did claims in California, and sometimes those houses are $2 million, $3 million. The VA doesn't count them as an asset as long as they're less than 2 acres. In California, that's usually the case. Now, if you're going to sell the house at some point, then it should be put into a residential trust so that the proceeds from the house go to the trust and not back to the veteran or spouse. That would disqualify them retroactively. Car doesn't count. I don't recommend going to buying a Lamborghini. Personal property such as furniture, jewelry, the VA doesn't count those. A final expense special caregiver fund is one that the VA does not count, and there's not a limit on that particular allowable asset. Next slide. So what happens if a veteran has too many assets, not enough income? Having a lot of money does not mean that you won't qualify. There's some additional planning that can be used to conserve your assets. Every case is different depending on where you have your assets. When we review a case here every day, we look at cases, and our 2 magic words are, it depends. So what we do with that case and the planning that we do will depend on the particulars of that case. Next slide. So let's say a veteran and spouse have $126,000. Is that a lot of money? Is this enough money to cover the cost of senior care? Next slide. So let's look at here where they're paying out about $5,000 a month or $38,880 per year, that they're having to tap into their savings to pay for their, their long-term care. So at $126,000, the second year they're only going to have 87,120 left. Third year, 48,240. The fourth year, 9,360. The fifth year, they're now underwater by 29,520. So is this where you go ask your children for help? Wow. Next slide. So this is what the VA benefit, okay? Using the same annual cost of care of $38,880, and the VA benefit is $27,180. So the started at 126,000. The second year they're down to 114,300. The third year they're down to 102,600. The fourth year 90,990. The fifth year 79,200. In the 10th year they're still 20,700. Next slide. So let's look at this side by side. So on the left side, that's where they do not have the VA benefit. And the fifth year, they're in the hole, 29,520. On the right side, where they do have the VA benefit, they have 79,200. Click. That's not a happy face on the left side, is it? On the right side, there's the happy face. So with the VA benefit, they're not running out of money. That's why that VA benefit is so, so important for the veteran and or spouse. Next slide. So the VA now has a 36-month look back on transfer of assets. So prior to October the 18th, 2018, you could just get your money away and qualify. We had an individual that came to us that had $2 million and he wanted this VA benefit. And I told him, well, sir, you've got a lot of money and you really don't need the benefit. And he looked me in the eye and he said, Sonny, I was in the Bataan Death March and I earned that money every step of the way. You know what I said? Yes, sir. So he gave $1 million to a convent in Philadelphia, and the other $1 million he gave to a church here in Jacksonville so he could qualify for that benefit. That's how important it was for him. Next slide. Next slide. So 73% of all claims are denied. Why? Because people try to file them themselves and they just can't do it. So we recommend connect with a service organization like the National Association of Veterans and Families to help get your ducks in a row while you still can. And like I said, we have over 99% claim approval. Next slide. So thank you for attending. And there's other programs that basically we're associated with, the VA Directed Care Program, which is a new program here in Florida. It's only been here now about a year and a half for veterans that are only for home care. And then the Florida HBCS waiver program, and that's for the assisted livings, and that's part of the Medicaid program. So you can go to our website at navf.org to find out more about our other programs and how we can help you. Next slide. So basically, if you want to email me at joe@vetsmatter.org, we'll be glad to basically respond to you and talk to you about the benefits that you may be entitled to or your parents may be entitled to, because here in Florida, we have a lot of veterans that are senior veterans that basically children are out of state. So we deal with those children that are out of state, usually via Zoom, okay, to help the parents that are here. Next slide.
Okay.
So that's it for me. So next.
Great. Thank you so much, Joe. Super valuable information. We've got about 20 minutes. Jessica, you can stop screen sharing and put all of us together. I'm going to go through the questions as they came in. And if it goes a little bit longer, the good news is we've got a little extra time. And of course, if we didn't get to your question, I will tell you how to reach out to our experts after to get your questions answered. So the first question, how long is someone on the waiting list? I know that Renee and Kadondra, that's a popular question that you get. How long am I going to be there?
There is no set time frame for someone to be on a waiting list. It is all depends on client frailty and when funding is available. So we cannot give any estimate of a time frame for someone to be on the waiting list.
Okay. Next question for you guys. What happens if I have a change in my health status? Can I get reassessed?
Yes, you would just call the helpline and schedule a new assessment if you've had a change in your health condition.
This particular question might need a little bit of a follow-up, and I'm not sure we can answer it right here. It says, my mother is under the long-term care program already in Ocala under elder options. Excuse me, she receives home care, but it's been very difficult to get respite services when needed. I would also like to get more information on the process to check on nursing homes for future need. My mother has mixed dementia and Parkinson's in a middle stage. So it sounds like a little multiple thing there. Renee, if she's going through elder options, do you recommend her going back to elder options to get these questions answered?
If she lives in the elder options area, yes. If she's part of the long-term care already and she has a managed health care plan, that organization that she's working with, then I would reach out to that case manager for additional services if she's already part of the managed health care, the MCO.
Okay. Where do most people get help applying for the Medicaid benefit? It's not a disability program. Would that be you, Renee, or?
If it's community Medicaid, then that would be straight through the Department of Children and Families. If they're looking for applying for home and community-based, our type of in-home services that we're talking about here today, then they would have to go on the wait list. They would come through us through the helpline for that screening and for placement on the wait list.
Right. Question, I'm not in the Elder Source region. Would I still use the 1-888-242-4464 helpline number, or would I go through the Elder Options helpline? And we have a number of people that are, that's nice, outside of our area. So Renee, guide them.
They can contact our 888 number and we would refer them to the other areas. And I'll look it up. I think there is a statewide number. Dondra, do you have that?
I don't know it offhand.
I can look it up while you guys are going through the questions and I'll put it, I'll recite it. So you're looking for the statewide ADRC number, the one that, okay. I'll look at
Yes.
it in a second.
Yes, and that would direct them to one of our sister agencies. Like I said, there are 11 of us in the state. So, and we cover the 7 counties of Northeast Florida. And Elder Options that you mentioned covers the 15 counties in the center around Gainesville, down to the villages and over towards Tallahassee area.
I do know that when I publish that number or share that number with you, when you call the statewide number, the magic of the phone system, it directs you wherever your area code is, it will direct you to the area agency that you're affiliated with.
Yes.
Okay. So, will a copy of the slides be provided to attendees? Yes, absolutely, along with all the resources and contact information. Somebody asked me a little bit ago, Joe's contact information. So you'll get that in a follow-up email. Or you can, joe@vetsmatter.org. My 93-year-old mother lives in her own and owns her own condo. Is she eligible to apply for Medicaid?
Yes, one home is usually excluded. It does not count against.
Okay. Where can I find information on successful liability cases brought against nursing homes? Trish, that sounds like a question for you.
So I'm not sure if it's on our site. I know that that's probably public record, but I can take that question away and get an answer for you.
Okay.
Because of the way it's posed, I'm not sure if that's something we have.
And I know that, I think it was Betsy Fallon that asked that question. If you have a little follow-up extra, Betsy, you might be able to have Trish answer that right now. So the next question is, why is there data on closed facilities? How can you tell if there are open beds? I think that's another Trish question.
So the number of beds on a profile page is the number that they're licensed for. If they are available or not, you may need to actually contact the actual facility because they only renew their license twice a year and or provide other information throughout that licensure period. That may not be the most current information. So we don't have a running open beds list for some facility types. So it may need to be that you have to contact that specific facility.
Okay. Can you search a provider by name? That person didn't see the option. And I think the answer is
Yep.
yes.
Yes.
Is there, I think that's one of the drop downs or one of the additional filters.
Generally, if you know the type of facility, that's the best way to do it. Pick your type, go into locate and get your results. And especially if you are in an area like a specific county, go ahead and search by the county. It's going to bring you results quicker. And then it'll give you a much shorter list to look at. You can just scroll through. But that filter that sits on top of the columns of your results, you can also start typing the name in there if it's a long list, and it will give you everything that it will bring back anything that's similar to what you're typing, and you can choose from there.
There was a question about Renee and Kadondra. What's the difference between Aging True and Elder Source? Either. So I think they're probably asking for, when you call Elder Source, you're connected to Aging True. How does that partnership work?
So Aging True is a direct provider of services. They have the community care for the elderly, home delivered meals programs, and other direct care services. So they are a provider. We are not a provider in that sense. We have some caregiver services, but Elder Source has the helpline and for information and referrals, and we complete the screenings like we said in our presentation. So Aging True, if you were trying to receive services from them, oftentimes you have to come through us anyway to be screened and placed on the wait list even for their services. So it's always good to start with our helpline, and then if it's something that you can go directly to Aging True for, then we would refer you to go straight to Aging True.
Other piece of information is that's Aging True is what we call a partner or provider agency. So we provide the funding to not only Aging True, City of Jacksonville, the Councils on Aging, Flagler County Senior Services. So they get the funding, state and federal, from us to deliver those services to you. So that's how we all work together, and we work, and again, it's a number of agencies in concert, making sure that the needs are met in our community. Let's see, if a husband and wife are not currently eligible for Medicaid, do you have to spend down all of your savings to be able to get to nursing home care? It sounds like maybe a DCF question.
Yes, we advise clients to speak with the Department of Children and Families or with the elder law attorney for more information on that process.
Great. So I think one of the things to point out too, maybe Renee and Kadondra, you can emphasize what we don't do, what we are not responsible for, what we don't have control of. So it's some of those eligibility requirements, like we don't take people off the wait list, correct? That comes through this whole process system that determines who is released from that wait list, correct?
That is correct. That is correct.
That is correct. And we do not do the medical approval or the financial. So that's done by the Department of Elder Affairs Care Unit, and the Department of Children and Families as the financial approval.
And I think it's important to remember, if you have questions like this and you don't understand, you can call the helpline. We can answer and direct you to where the call really needs to be made, and when it's not us. Let's see. Are there service? I'm sorry, go ahead. What?
It's Renee. I have the elder helpline at the Department of Elder Affairs level. I have the phone number. If you want me to.
Yeah, that would be great.
Okay, it's 1-800 963-5337.
I'm going to see if I can put that into the chat.
Okay. And
Um,
some people may know this statewide Medicaid managed care, long-term care program that we're talking about, the home and community-based, used to be called Medicaid waivers. But when in the 2013, 2014 time period, Florida went all under managed care organizations, and that therefore a new name, statewide Medicaid managed care, long-term care programs. So, it's all coming through us. We're the point of entry.
so Jessica put that in the chat. Thank you, Jessica. A couple more questions and then we will wrap up. Are there services or agencies that offer this or similar assistance for non-veterans or ineligible veterans? If so, how can we access that information? I don't know if that's a Joe question or it says services or agencies that offer this kind of assistance. And I presume it might be, Joe, the guiding of applying
Okay.
for
There, basically, there are several programs that the VA has that are strictly for the veteran and strictly for home care. And so, yeah, you would go to their primary care physician, and primary care physician would refer them to a special social worker on the VA directed care program. Then that social worker would then go to the home of the veteran and our spouse and determine how much money they would get. That could be anywhere from $1,800 a month to $4,800 a month, depending on the level of care that's necessary for the veteran. It's only for the veteran, not the spouse.
Okay. I think this question's for you, Joe. To get VA spousal benefit, does the spouse need to have been married to the vet during their service time?
No, they just have to be married to the veteran currently. If they get divorced, that's it. They can't get benefits. But as long as they're married currently, at least 1 year to the veteran.
Very good. If a person has a personal cleaning company and they want to contract with a company like a lead agency, what do they need to do in regards of ACA certification? It's an interesting question. I don't know. Do you know that?
So, no, because we only license healthcare facilities and specific types, that 37 that I said were on the list. So we license or provide certificates for them. We also did like just putting information on our website. We put we link to some national sites that are, that are trusted and that we have partnerships with. But we don't put just advertise for services on our site. It's just not a place for that.
I think we've got a couple more. My parents are receiving Aging True Meals on Wheels self-pay. I am told once funds become available, they can get on the free service for this. Is there any information on when funds may be available? I think that's we don't know because we are not in control of that, correct?
Correct.
Good. I'm glad that somebody has had a great session here. I need to find a phone number to speak with someone at ACA who can assist me with changing my spouse's Medicaid MMA coverage into institutional care program coverage so that I can get her admitted into a nursing home that I've applied for. This is a person who's a power of attorney and they're authorized to manage on her behalf. Does anybody have any information about that? A phone number to speak with somebody at ACA who can assist me with changing the Medicaid MMA coverage.
So go ahead. I was going to say on Florida Health Finder and on that very first link where it says information, it says over there. It says agency information. There's a link that's Medicaid general information, is a whole list of numbers and contacts and things that they would need. Or you may have them go to, if you'll just share the link with them after, the one that Renee put up at the end of hers. I think those would be the two places they could go to start that process.
Cassandra, did you
The
have anything else?
Department of Children and Families handles the nursing home application, so you would have to apply with the Department of Children and Families for the nursing home Medicaid.
Right.
And
And I
last,
think.
go ahead, Trish, sorry.
I was going to say, I think on our page that has the information, I believe it says that as well.
Great. Last question. More about spousal VA benefits. If the vet is deceased, will the spouse still be eligible?
Yes. And the answer to that, and so the spousal, the widow, if you will, is eligible for benefits. The other thing I might talk about is for the veteran that's at home, the VA will pay up to $6,800 to lower countertops, put in ramps, things like this, and it can be a rental home. They don't have to own it to be able to do that. And so that's something that's overlooked a lot. The other thing is if the veteran is confined in a wheelchair, the VA will provide a vehicle every 2 years to that veteran, free. And so there's a lot of hidden benefits that people just don't know about. Going back to what I said at the beginning, you don't know what you don't know. So we know a lot, and if we don't do it, we'll tell you who does.
This is tremendous information, and I would be remiss if I didn't mention that ElderSource has a veterans directed care program with the ultimate goal to keep the veteran living at home and not go into a nursing home. The veteran or the caregiver would contact their VA physician or social worker for a referral to this program. And essentially, that family or the veteran has the opportunity to hire their own caregiver. So if I am the spouse and I want to get paid for my support of how I'm caring for my loved one, my veteran, there is a process that we will work with you and set you up as an employer and get paid for that. So I'm really oversimplifying what this program is all about, but calling the helpline, 1-888-242-4464. Jessica, if you could put that in the chat, that would be awesome. And so again, these experts that we have here today are tremendous, and I can't thank you enough for being available to answer some really complicated questions. So as I mentioned earlier, we will be sending out the recording and the slides and the list of resources and all the links for you to go back, refresh your memory, and of course, share all these resources with people in your family. Thank you so much on behalf of all of our speakers of ElderSource and the Caregiver Coalition of Northeast Florida. I hope you have found this to be beneficial. And please call us. We definitely want to be there to help you navigate this complicated journey of long-term care assistance. Thanks again, everybody. And we're going to let everyone exit the webinar. I'm going to stick with my speakers for just a minute more. Thank you. Have a great day. Guys, we had almost 65 people attend today. It was awesome. Yeah, we had 136 RSVP and about